Have you ever been told that you have or your loved one have vascular dementia and you are wondering what is that and what you can do about it? I will tell you what is vascular dementia and I will give you a recommendation to prevent or at least slow down the progression of this condition. Believe me, if you are in your 40s, this video is very important for you. My name is Dr. Zayas, or Dr. Z. I am a neurologist located in East Tennessee. The first thing that we need to do is to define dementia. What is dementia? Dementia is the term, is a big term that we use to tell you that you have cognitive impairment, not just memory issues, cognitive impairment, which has many areas, many domains. Memory is one of them, but it has to be severe enough to affect your daily activities, your function. Many patients, they have mild cognitive impairment, but it's not severe enough to affect function. So we don't call that dementia. Now, what is the most common cause of dementia? Alzheimer. Alzheimer is the most common cause of dementia, approximately 60%. Vascular dementia is approximately 20%. However, these conditions, when you get older, these conditions overlap. So these numbers of 60%, 20% are not too accurate because there is many times, frequently, you have a combined process. Now let's discuss about the main pathological difference between Alzheimer and vascular dementia. I will try to be very simple. Number one, in Alzheimer, the main problem, the main pathological issue is that there is a protein built up called beta amyloid. When this protein fall incorrectly, it aggregate, accumulate, stick together in the brain, affecting the normal function of the brain. On the other hand, when you have vascular dementia, the problem is not actually caused by accumulation of abnormal protein. Instead, the problem is lack or decrease blood flow to specific areas of the brain. In other words, the brain cannot get enough oxygen and essential nutrients because the vessels are not working well. So the cells in the brain start dying, and that's the problem with vascular dementia. We like to see, we are very visual, at least I am. Let me show you how a patient with vascular dementia and Alzheimer looks on MRI. Remember, there is a lot of overlapping between these conditions, and the majority of the patients with Alzheimer also have vascular dementia. Just for the sake of simplicity, let me show you these MRIs. The first one is a patient with sudden onset of acute altered mental status, and the MRI is showing a right temporal lobe lesion, presumed to be an infarct or what we call clinically a stroke. The second MRI that you see is from a patient with chronic progressive cognitive deficit with significant white matter disease. You see the white spots on this MRI, presumed to be what we call, in medical terms, a small vessel disease. This lesion might cause severe cognitive issues, frequently severe enough to cause what we call vascular dementia. On the other hand, you see this MRI of a patient clinically diagnosed with Alzheimer and how it differs is how different is from a healthy brain. On the left, you see the amount of atrophy, shrinking of the brain, especially in this area that you see here, what we call the temporal lobes. And you can compare with the normal MRI. Now let's talk about how these patients with vascular dementia present in the clinic when you compare with patients with Alzheimer dementia. Well, I will try to be simple here because this is more complex. Remember, those conditions overlap. But for the sake of simplicity, let's say that Alzheimer patients usually present with short-term memory issues. They repeat a lot of questions. So memory is the predominant issue. In people with vascular dementia, the main issue is executive function, similar to the type of dementia that you see with Lewy body disease. I mean, dementia with Lewy bodies. Executive function, which is what is mostly affected from the beginning in patients with vascular dementia, is the area of the brain, the area of the cognition that is related with multiple task activities. So patients that have issues going from point A to point B, following complex instructions, following a recipe. That's the main problem with vascular dementia. In addition to processing speed, how fast the brain think. Also, you might have problems with memory acutely in a patient who has a acute stroke, especially when it's affecting the temporal lobe. So those patients present with memory issues, and we classify them as a vascular dementia. The good news is that vascular dementia is technically a preventable condition. In the same way that you can prevent heart attacks, they actually have the similar risk factors. Age is the main one, and we cannot do too much about it. But these 10 risk factors, yes, we can do many things about it. Number one is high blood pressure. Number two, atrial fibrillation. Atrial fibrillation, which is a normal rhythm of the heart, that if you have that, that might actually can cause you to release clots going to your brain, causing you strokes, right? Number three, congestive heart failure, CHF. CHF. Number four, severe internal carotid stenosis or narrowing. There is an important artery here that we have that irrigate the brain. Number five, diabetes type 2. That's a big one. Number six, low bad cholesterol. Actually, low of the good one and high of the bad one. There are different type of cholesterol. Number seven, smoking. Number eight, being, I guess, lazy. I don't want to call it lazy, but it's a sedentary life. Like you don't want to get out of your comfort zone. That's a big risk factor. Number nine, sleep apnea, a big one, sleep apnea. Number 10, obesity. Those are the 10 major risk factors. Now, I have to tell you, there are three labs, very important, that you need to check in anybody with cognitive issues. Number one, it doesn't matter if we are talking about Alzheimer or vascular or any other. So anybody with cognitive complaints, you check for thyroid function. So make sure that you have your TSH normal. Number two, vitamin B12, and number three, vitamin D. D. Now that we already talked about risk factors, now let's talk about the most important thing, which is what to do. So what can we do with those risk factors? And we are going to talk here about the Life Essential 8. And this data is from this article that you see here in the screen, published in 2010 by the American Heart Association. And my personal opinion. Number one is modification of your eating habits, or what we call a diet. Having a healthy diet. Which type of diet? What are we talking about here? Well, the Dutch diet is one of them, and the mind diet. The mind diet. And I have a video that describing what is the mind diet. The link of this video will be in the description of this video below. I personally follow the mind diet with some modifications. So in the mind diet, they allow you to eat 4 portions of red meat, I increase a little bit more. I go a little bit higher than that when we talk about red meat. But otherwise, I try to follow the MIND diet. The MIND diet is actually a combination of the Mediterranean diet and the DASH diet, which is a diet that if you have high blood pressure, this is the diet that you should follow. And again, I describe the DASH diet in this video, and the link will be below. Number two, physical activities. Very, very important. But remember, the most important thing, in my opinion, is what you eat. Then this is the second one, is what you eat. It doesn't matter how, if you run and run and run and do exercises every day, but if you eat cake, pasta, carbs all day long, nothing's gonna work well. Okay? So you need to modify what you eat. Then physical activities. How much? How much? Well, this is the recommendation, is approximately 5 days per week, 30 minutes. Okay? 5 days per week, 30 minutes. Moderate to high intensity exercises. I cannot tell you what is that because everything depends of your conditions around you. So the routine of exercises is not the same than your neighbor. It's not the same because everybody is different. So my recommendation is for you to see a personal trainer. If you have a lesion, for example, a hip lesion, a shoulder issue, then it's better to be seen. It's better you to see a physical therapist to design a specific routine of exercises for you. But otherwise, a personal trainer would be fine. A certified personal trainer. If you ask me, okay, but what do you recommend? Do you recommend any specific exercises? Again, that depends of you, what you like, your age. But if you insist, I will tell you that I will recommend at least 2 days of weight training, 2 days per week. I'm talking about per week of weight training, and at least 4 days, 3 to 4 days of some type of cardio, either biking, either fast walking, or jogging. Number three, smoking. You know what I'm going to say about that. No smoking. Number four, very important, and is improve your sleep. You should be able to sleep 7 hours of good sleep. How do you do that? Not with pills. Pills is they're not going to help you a long term. They might help you for a short term, but the most important to sleep well is to have a good sleep pattern, a sleep habits. We call that sleep hygiene. So, which means that you go to bed at the same time. So, for example, I go to bed at 10 p.m. and I wake up at 5 a.m. So, more or less. So, it's just an average of 7 hours. That's very important. And you know, you have to do things. For example, this is common sense. Try to avoid fluid 3 hours, 2 hours, I say 3 hours before going to bed, before going to sleep. Okay? Otherwise, you will be waking up one, twice at night to pee. And this is going to affect your sleep. And another thing is try not to have any lights in your room and cool temperature. So we have data that you need to make sure that the temperature of your room is the correct one. Number five, body mass index less than 25. Body mass index, BMI, which is body mass index less than 25. Obviously, this is a formula which has some limitations, but you should always follow this formula in the general population. Number six, keep the ratio between total cholesterol and the good cholesterol below 130. So basically, you get your total cholesterol minus your HDL and try to get this number below 130. Okay, very important. This is close to 100, and if you have below 100, even better. Okay. Number 7, fasting glucose. Fasting glucose has to be below 100, or what we call hemoglobin glucosylate or hemoglobin A1C below 5.7. That's your goal. Number 8, which is very important, is blood pressure. So you need to treat your blood pressure. Your goal is to have a blood pressure of 120 over 80. Below that. Okay? So as long as you don't have any symptoms of low perfusion to the brain, like feeling dizzy, lightheadedness, that's a different thing. No, you don't want that. Okay? But that's the recommendation for the general population. If you like this video, don't forget to subscribe to my channel and follow me on my Facebook page. The link will be in the description of this video below. See you soon.